Hi everybody, this is Carol from the Society of Thoracic Surgeons. This is the Adult Cardiac User Group call for July 15th. Thank you for joining. We will get started now. On the call with me today I have our IQVIA team, Melanie Bent and Jill Brower will be giving updates. And I have Melinda Offer to help me answer some version 4.20 questions if you have them. And a bunch of other staff from STS and IQVIA who have joined us today. This call is the user group call, so please feel free, submit your questions. We'll get to them after a quick presentation. I do have some updates for you from STS. Melanie and Joe Brower will have some IQVIA updates, and then if you have user feedback or you have a question that you've been waiting for, maybe something that's been pending or you would just like a little bit more clarity on, please use the Q&A function, but include your ticket number and case number if you have that from IQVIA to help IQVIA track it after the call and follow up with you. STS updates, the Harvest 1 2020 report is not yet available. It is in progress. We do not have an official release date. Right now the data is at DCRI. The analysis is done on it. It is being, IQVIA is preparing to ingest that data back from DCRI. As soon as we have more of an official release date or a more official timeline on when that data will be available to you, we will communicate that out. We certainly apologize for the delay in that, and we realize that it's not ideal to be working with data that is so old in doing quality improvement projects. But after this initial experience, the timeline will greatly improve and these turnaround times will be much shorter. So I appreciate your patience while we're working through that. As soon as we have more information, we will let you know when that will be available. For version 4.20, the training manual was updated, I believe, on July 6th. There are worksheets that were posted. I am working on a few additional aorta worksheets, and I hope to have those finished by the end of the week. Last week got away from me pretty quickly and I wasn't able to get them done by Friday, so I hope to have those done by the end of the week. And I do have a few identified issues for version 4.20 that I'd like to go through, and of course answer your questions if you're finding anything else on version 4.20. And I do see a question in here that our hospital requires the harvest. I'm not going to stop and answer questions, but because this is important and I know everybody's waiting for their Harvest 1 report, it says that they require the Harvest 1 report by July 31st. It will not be available to sites by that time. As soon as we have a more definite timeline out, though, we will communicate that out to sites, but I can guarantee it will not be available by July 31st, unfortunately. So the first area I wanted to talk to about that we needed to talk more, I needed to do a little bit more education on is an issue that came up in 2.9. I thought that we had corrected it in 4.20. For some reason it slipped through and was not updated. And this is related to the model number in the aorta section. So let me also open the data collection form here. Hold on one second and I can show you better. This is the data collection form. So for the models in the aorta section, when we're doing the devices, we can enter the aortic valve or aortic valve composite grafts implanted. You enter the model number, and this is a drop down. So you would click on this and then select from a list of devices the model number that goes here and then implant size and UDI. Again, this is for aortic valve or the composite grafts, which is the valve and a valve and a piece of aortic graft material. Then for grafts alone, you're going to enter these, you're going to enter the grafts alone down here. Location, implant method, outcome. The issue is when we get to model number, this was left as a text field, which means you have to type this model number in. That gets really messy when we ask you to type this in because it can be inconsistent and we can have different information on that label that you're looking at, or if it's scanned into the record, that can get confusing. So this was supposed to be a drop down for version 4.20. For whatever reason, it was missed. We're not going to do a version revision because of this at this time, but I am going to educate on it and provide some tools to help you identify what number gets typed in here. And then the UDI is the UDI that needs to be scanned into the chart. So the model number, I'm going to go back over to my slides here. The model number is this field. Its format is text. It should be format categorically specified by the STS. So the format is incorrect on this field. You're going to have to type in the model number. And on the next slide, I just want to show you, this is an example of what the model numbers look like. This is the gel weave Valsalva, which is a Teromo gel weave vascular prosthesis. It's a Vascutech graft. They're often used for usually valve sparing or Bentall procedures. And it's the catalog number which corresponds to the model number. So this sheet on the left where it says we'll provide you with the cheat sheet in the coming weeks, I'm going to pull out the aorta grafts from the list that's currently under the valve section. So there, in the data specifications, there's a whole list that makes up that drop-down list you see when you're entering valves in. On that list, you'll also see the aorta devices. I'm going to pull those out separately and post a separate sheet on the website so you have easy access to that to see what these common model numbers are. So when you have to type it in to this space, you'll have that available. I apologize if that happened and it wasn't corrected in 4.20. Hopefully, hopefully it will be at least a little bit helpful to you in typing that in so you know what it's supposed to look like going in. So it's something like the 7300 and then this number sign ADP. This is the model number and then this is the size. This whole thing makes up the model number. This is the model, the size, and then the ADP is the identifier for it. So here it would be 730016 ADP. So that's what would get typed in. This is what you would type into that model number section. So we'll provide more education on that and we'll talk about it in the next webinar as well. Also another issue that was identified, which is a very minor issue, the data collection form under readmission says that if status at hospital discharged is discharged alive, last known status alive, or discharged alive, died after discharge, that you should fill in the readmission. One other selection that's missing here for hospital discharge is the patient was discharged to hospice. It's included in the data specification, so readmission will still open. It's just not listed here in the DCF language that's at the top of this section. So you will fill out the readmission section for discharged alive, last known status alive, discharged alive, died after discharged, or discharged to hospice. And then the last thing I think I had to talk about the upgrade was on the substance use screening and counseling performed. We have had quite a few questions come through on this, and mainly I think the reason is because it is a new field. And it's a little confusing, something that we've never done before in the database in this type of combined field. So I'm just going to go through it and hopefully this will answer some questions. The first thing I want to point out is at the top of the screen, this is what's on your data collection form. This is in the discharge section and the choices are yes, no, or not applicable. The definition, this is from the training manual. Both screens here are from the training manual. This NQF measure, it should read NQF 2597. We aren't, once the data specifications get made, we aren't allowed to go in to update the long name, short name, or definition. These are static until there's a major version change. So we can't go in and update any of this language, but we did clarify in the intent clarification. So this NQF measure is actually NQF 2597, which is clarified down here. And what this measure is for patients, you have to have proof within the last 2 years that your patient was screened for tobacco use, unhealthy alcohol use, and non-medical prescription drug and illicit drug use. and if screened positive for any of those, was counseled. And if you're able to say that, say your patient had had a recent smoking history and screened positive for smoking. And the first question that has come up is, well, what screening tool are we to use? And the screening tool that sites are to use is whatever is deemed appropriate by your institution. There are many different screening tools available, and it has to be a systematic screening method that's determined by each facility. Whatever that may be at your facility, it can differ across facilities, but you have to have something in place where you're screening the patient for these three things. So if you have a patient who screens positive for tobacco use within the last, whatever the last time that patient was screened, if they screened positive for tobacco use, as long as that screening occurred within a 2-year time frame, then the patient would meet the need to be counseled for that tobacco abuse. If the patient who screened positive for tobacco abuse screened negative for the other two issues, which are included in the measure, alcohol use or non-medical prescription drug or illicit drug use, and they received counseling for tobacco abuse, then you could code this as yes, that the patient had substance use screening and the counseling was performed. Another example would be the same patient who screened positive for tobacco abuse and no for the other two items, did not receive any tobacco cessation counseling, then you would screen no for this patient. For patients who screen negative for all three and no counseling is indicated, then code yes. Melinda's going to add that into the training manual to provide a little bit more clarity on that, because that has been also one of the questions that we've received. So we'll make sure that that's added in. And I think that's everything. Melinda, do you have anything to add or anything that that I may have not covered correctly?
Well, the only thing that makes it simpler in my mind that I would like to add is, in my mind, this is a two-part question. First part is, were they screened? And the second part, was counseling provided if needed? So if you screened them and you counseled them, whether they needed it or, if they screened negative, then you didn't need counseling. So that's a yes. If you screen positive for one or two of these areas, then they have to be counseled in order to code yes to those one or two areas that screen positive. So it's really a two-part question.
Great. Yeah, and it's similar. The two-part questions remind me of the COVID questions, and they can get a little confusing if we read too much into it. But just take it for what it's for. And if the patient screens negative to everything, no counseling is indicated, code yes. If the patient screens positive for anything and counseling is performed on those issues, code yes. If no counseling is performed when the patient required it, then you would code no, right? Melinda?
Correct. Sorry.
Correct.
Trying to find the mute button. Correct.
Oh, it's okay. All right, good.
And this is Donna. Carol, can I add one more thing?
Sure. Yeah, absolutely.
This measure was required by CMS for sites that will be participating in the bundled payment program. That may not impact everyone, but this is one of the standard measures that CMS is using, and that's why it's structured this way. We didn't have a lot of choice in the matter.
Yeah, that's true. Thanks. That's helpful. Thank you, Donna.
Thank you.
We had no choice. Okay, and then I'm going to hand it over to Melanie and, is Melanie and Jeanette? Did I take up the wrong slide, or is it Melanie and Joe?
It's Melanie and Joe.
Sorry, Joe.
That's okay.
So I will introduce Joe. So Joe Brower is on our IQVIA team. He is on our tier 2 level support. Some of you may have already interacted with Joe with some resolutions to tickets you may have called in. But we are going to have Joe participate with us in this webinar and upcoming webinars, and he'll be sharing upcoming release information related to items that have been identified and slated to be fixed. So with that, I'll pass it over to Joe.
Okay, thank you, Melanie. Hi, everyone. I'm glad to be joining you this afternoon to start sharing with you these updates. So without further ado, let's go ahead and start with the first bug there under the data quality report STS 3423. So what's happening is when you run the data quality report after you do an upload and you click that view reports button, then you click on your warnings pie chart to show the warnings for all your patients, it's automatically highlighting everything. And while you should be able to click on individual records, it's currently not allowing you to do that. So even if you click on an individual record, it's still going to show you the full case list in the bottom. So that's what this bug is in regard to. So once that fix goes through, you should be able to click on individual records to show the warning messages for those records in particular, rather than being forced to view the whole case list at once. The next one, STS 2976. So for this, we had a user who was getting a warning message in regard to, it was saying that the AFib procedures section was missing. And it shouldn't have been triggering a warning because it wasn't applicable. The user had not indicated that, that there was surgery. And so those data elements weren't even available for the user to enter. And so they shouldn't have gotten the warning. And this fix should resolve that issue. STS 3241. With the harvest summary report. So what's happening there is the harvest summary report is showing warning messages for the urgent or emergent reason data element. So when shock is selected, either yes or no there, it's saying that the cardiogenic shock data element is not marked yes, even though it actually is. And so it's giving warnings essentially for the cardiogenic shock saying yes when it shouldn't be. And so those will be addressed for versions 2.81 and 2.9 in the upcoming release. Moving down to the dashboard report, STS 2290. The dashboard report is currently, it's not showing anything for the nasopharyngeal option when it's entered for the core temperature source. So the dashboard report, even if you do have records where that is selected, it's going to show 0 on the dashboard, which is obviously incorrect. And what it seems to be actually doing is lumping those in under the tympanic selection, which is even further wrong. And so this fix should resolve that, so the nasopharyngeal is separated and properly displayed on the report, and the tympanic results would be corrected that way as well. All right, next slide, thank you. So next we're gonna look into some issues with the missing variable report that are gonna be resolved. So STS 2486, this one is pretty straightforward. Currently the 4.20.2 variables do not appear on the report, but once this release goes through, those will be added for you. STS 3162. So what's happening in this case is a few sites have reported that they're experiencing an issue where they're seeing a higher number of patients than were actually missing the data element. So in this example, that for when we initially logged this bug, the report was saying 6 patients were missing, but then they click on it and the case list only shows 3. And so that will be resolved so that the correct numbers are displayed. STS 3186. So this one is pretty straightforward as well. What was happening is the missing variable report is showing that discharge date is required for patients who expired. And so that will be corrected so that no longer appears on the report. And then finally, STS 3226. Similar to the one a couple before this, the MVR is showing percentages over 100%, which obviously shouldn't make any sense. And so that is a display issue that is being corrected. And so once that fix goes through, the percentages should display correctly. And that should do it for me.
Okay, thank you, Joe.
Thanks.
So I will take it back over. This is Melanie. So what I wanted to do is go into the critical summary report. We did cover this before, but I just want to make sure that for those that may not have been on previous calls where we discussed this, to just do a quick overview for this report. And then we also have a future report that we will be enabling and will have available prior to the harvest close, and that's going to be the risk score match report. So just wanted to at least go through this update with the critical summary. So The way you would access this report, and this is currently available within your site. So when you log in and access any data quality report, you will be able to get to the critical summary. And the way that you access the data quality report, of course, is through the View Reports link that's available on the uploader card. As soon as you select that, of course, the DQR is going to open and there will be a new tab that is available. So if we go to the next slide, we can take a look at where that is. So on this slide here, this is the actual critical summary interface. But if you take a look at the very bottom, initially what's going to appear is the data quality report. Okay, and then you will see at the very bottom on the left-hand side, there will be an additional tab that is called Critical Summary. And this Critical Summary will bring you to this interface. Again, you're able to access this report with any data quality report entry. So any report that you access, you'll be able to get to that tab. And then in order for you to generate this report, you would enter in a time frame, and the time frame is going to look at the submission dates. And so for this example, we put in the January 1st, 2020 through May 1st, 2020. And so all of the submissions that are applicable during that time will then display in the report. And so you'll see that first column is going to be your submission date. Next to that, you'll have the upload ID, and then you'll see within those individual upload IDs, you will be able to see the first surgery date of the case that's in that submission and the very last surgery date that's in that submission. So you're able to see that information here. The other thing that you're able to review is, of course, the status of whether or not the submission actually passed or failed. And then you'll be able to even see the total number of records that are included within that single submission. So you'll see on the example that we are reviewing here, total number of records in that submission was 3. And total number of successful records in this submission is actually, let me see that line. Is it a 0? No. Oop, we clicked away. Let's go back. That actually, let's look at the very first line rather than the one that's highlighted, because I don't know what that entry, I took this from a test environment, so unfortunately you may see an item that's not lining up. So the very first entry, we have total of 3 records, and in this example you'll see the number of successful records was 2. And so in this example, we had total of 3, but only 2 were successfully saved to the database. And then we had 1 that failed. So in that specific example, when we see 1 that failed, most likely we encountered a critical error. And in order for us to review that actual entry, that data quality report, we can actually select the hyperlink that is listed as the data quality report, very last column. You'll see that you're able to navigate specifically to that actual submission. And at that point, you're able to review the associated critical record that failed. So you're able to navigate that through there. The other thing that I wanted to point out is that if we were to go back to the left-hand side of the report where you have file status, there's some additional filters that are on the very left. It's under the run report section. Yep, thank you. So right underneath the run report option, you'll see file status. That will allow you to filter the list, and if you only wanted to focus on the entries that passed, you're able to do that. If you needed to focus on the entries that failed, to maybe just take a review of those, you're able to do that also. If you do not have any failed submissions, this filter will not display a failed option. So just know that it is dynamic. So if you were to go to your report to review it and you notice that there was no option for you to sort on failed, it's because you have no failed entries. So it won't display that actual filter. Okay, so I just wanted to point this out. And again, this will allow you to have a holistic view of all of your entries, your submissions, and be able to see just a high level how many records were included in your submissions, how many failed, how many were successful, just in a quick glance using this report. Okay, so let's go on to the next update, which is related to a future report. This is just a concept at the moment. We are working in development on this, but we wanted to give you a preview of what that report will look like. And so you will be able to access the report the same way you are accessing your dashboard or your missing variable report. There will be another entry or another hyperlink that will be called risk or match report. And so once you navigate there, you're able to enter in a criteria of 2.9 records or 2.81 records or 4.20 records. Right now, the report will only have 2.9 at the moment when we release it, but we will be allowing other, of course, data versions where you're able to do that comparison on those versions also. So on the report, you'll see that you have two levels, a summary level view and a detail level view. And so on the summary level view, when the report generates, we're able to default all of the results, and that's what you're seeing right now. You'll notice that there is all of the cells for percent match are currently highlighted in blue. That always will indicate that the report is displaying the results for those selections. And so at the very bottom of the report, in the detail level, you're able to then review the individual records that are associated with those actual categories. And in here, you're able to determine what is your match rate versus no match rate. And items that are identified as no match with what is being sent in the actual DAT file, so what's being generated from your vendor versus what we have in the data warehouse, we're showing that comparison, and we are highlighting items that are not matched in the red cells. So you will have a quick way to be able to visually see those actual records that do not currently match. So the other screenshot that I have at the towards the end or towards the right, you'll see that you're able to, of course, select individual entries. So if you're looking at the category of operative mortality, valve only, in this example, you're able to select that actual percent match, and you'll see all of the associated records with that category listed. And so you will be able to see, of course, the time period for that record, individual record ID, the associated PROC ID, and then, of course, what was sent from the software vendor and what the data warehouse currently calculated, and then, of course, show you the result for that. So just wanted to show you that, again, more reports are on the way in regards to being able to give you more information regarding your data. So this is a sneak peek in regards to what's coming. And I believe that is the last slide. Let's just double check. Yep, that is the last slide that I had. So I will pass it back over to Carol in regards to the support plan.
Hi, Melanie. Thanks. And thanks, Joe, for the great update. I had a question for Joe where did it go? Before we get moving on the questions. The percentage for the missing variable report where it's displaying the greater than 100% missing data fields. Is that on a certain field, or is it happening to everybody, or
let me pull that bug up and I can get an answer on that for you.
Okay.
I want to say that was not happening for everyone. It was not across the board, and it was in certain variables. So that was not, so some users may not encounter that specific issue. I believe there was more than one that reported it. And in those instances, those users were referring to the same variables. So that's why we wanted to bring this up, just in case anyone else may have seen it. but it was not across the board with all variables. It was specific ones. I'm trying to see if I can also see.
Oh, that's okay. I just wanted to make sure that not, because I didn't see a whole lot coming through, just a few users who had reached out that we passed on. I just wanted to make sure it wasn't widespread. Everybody was seeing something.
Yes, and thanks for clarifying that, because I'm sure others are probably like, well, maybe I haven't encountered that, or should I be seeing that? But no, not everyone was encountering that.
Okay, thanks. So not everybody needs to worry that their missing variable report is going to be affected by it. Okay, so the IQVIA support plan, again, the STS tech support at IQVIA.com is the email to if you're having any platform issues. And the phone number is listed 833-256-7187. That will get routed to the Tier 1 IQVIA support center, the contact center. And they will then decide if it's something that they're equipped to help you with, which is usually password resets and accessing the platform issues. If it's something beyond that, they'll most likely escalate that to Tier 2, send you an email saying that your Tier 1 support ticket was closed and that it is escalated to Tier 2. There will be within the body of that email, there will be a ticket number that you should refer to in future if you need to reach out to IQVIA, or if you have multiple tickets with them, refer to those ticket numbers so there's no confusion. And if you are reporting that issue a second time or you're looking for a follow-up, make sure you reference that ticket number so they don't open multiple tickets for you. Once it goes to Tier 2, it will either come over to STS or Tier 2 will manage it. And if we need to work with the database vendors, we will certainly do that. However, if it is a vendor issue at your software level, then you should probably reach out to your vendor first, so you don't have to wait for this whole long process. And then if it's something that STS can't handle, say it's an analytic question that we may not be able to answer, or it's a version upgrade, a database version upgrade related to the data collection form that we're not able to answer, hopefully we can answer those. But if it's more of an analytic question that's beyond our scope, we would reach out to our analytics team at DCRI. So there's that, and then the resources. We have the webpage, the STS Tech Support at IQVIA.com, and then the National Database Feedback Form. All of these can be found on the STS.org National Database homepage. And now we're going to go to Q&A. We'll answer as many questions as possible, and we encourage your feedback. I am going to, let me see if I can make this smaller if I just screwed that up. Hold on one second. I want to be able to pull over my other screen too, because I think we're going to have some questions that I'm going to need this for. Okay, here we go. First question. Can you clarify the change of discharge hospice patients being counted as mortality? Sure. So, Kristen, I would suggest that you check out the webinar, the last webinar that we had. I think it was on June 25th. Let me double check the date for you. Actually, it may have been, I believe it was on July 1st or June 25th. One of those we went into great detail on that section. So I suggest reaching out, reviewing those webinars if you haven't reviewed them already or haven't seen them already. The discharge patients to hospice will be counted as mortalities for version 4.20. Next question. So the posted worksheets are not final. The posted worksheets are final, and I wanted to show you where those are at. So STS.org, I went to Registries and Research, STS National Database, and Adult Cardiac. Under the Access Data Collection Resources, version 4.20, you'll see the surgeon worksheets are listed here. There's one aorta worksheet that's available. This is for the open dissection. There are going to be multiple aorta worksheets made, and I hope to have those finished this week. The other ones are final. And you can tweak these however you want, whatever works best for your site and your surgeon. They're posted in both PDF and Word version. So the PDF version, I think, prints better. So if you open it in Word version and you make changes, you may want to save it in PDF so the margins will print correctly. But you can go into these and you can manipulate them however you want, add things in that might be specific for your surgeon or site. But the ones that are posted are final. Next question. Anthem Insurance is asking for September to December 2019 data. Can STS contact them about the report delay? And Donna, did you want, I don't know if this is the same as our Anthem report or if this is something different.
I'm not sure. Anthem already received the report that they contract with us to receive. So perhaps your site's not included, but long story short, we will not have the official report until the data is transferred from DCRI to IQVIA and then surfaced on the dashboard. There, I don't know what else to say. It's out of our control, really. They're working on it, feverishly working on it, and as soon as we can make it available, we'll definitely be sending out emails and letting you know that it's available.
Great, thank you, Donna. And the reason why the Anthem report was delivered to Anthem, the contracted Anthem report was delivered to Anthem, is because DCRI finished the data analysis on the data that they have in the warehouse, and they were able to do that report for us for STS, and we were able to send that over. That's why that report had been sent already.
Right, but it doesn't include everything that the participant reports include, which is why additional analysis needed to take place on all the participant files.
Thank you. Yes. Okay, next question. And Melinda, this one, I'm not sure what she's asking. How should isolate be captured?
I was looking at that too. I mean, isolate's like an electrolyte solution, so I'm not sure, Amy, what you're asking about that. Maybe just send me an FAQ and clarify what you're asking about the isolate.
And then I can take the bicable question. So in the training manual for bicable cannulation sites, we're capturing right atrium and SVC. Those are the true, those are where the patient is cannulated. So that's how we're capturing bicable. I think Melinda will be providing a little bit more clarity for we had an example, which I think is rare, but happens at a couple sites where they cannulate the SVC and what was the other one?
And they directly cannulate the IVC, and that's we're going to be taking that to the surgeons tomorrow to talk about that. And so look for clarification if you're one of those sites that does that.
And for general bicable cannulation, we're capturing that as right atrium and SVC. Thanks. I just want to confirm that nothing has changed in regards to harvest submission if we submit a case or batch of cases at a time. So you have to submit however your vendor allows you to download. I believe it's a time frame, and Melanie, you might want to verify. I believe that they have to submit we don't do one case at a time. Is that correct?
That's correct, but there's nothing changing. So just it's the same process of what you're doing now. There's nothing that's changing in the submission.
Great, thank you.
Mm-hmm.
Next question. I was typing and missed the update on the harvest report. The harvest report is being delayed past July 31st. We do not have a date yet for the harvest one report. It will not be before July 31st. As soon as we have a more concrete date, more concrete timeline, we will be communicating that out to sites. Just to make sure, yes, we are aware that Leapfrog and Anthem QHIP are looking for data, but I think you could probably use your previous submissions, but we're not, we're working on the harvest reports as quickly as we can, and we'll get them out as soon as we can. I entered a case that was an aortic valve replacement with annular enlargement NICS procedure. Since the enlargement was done, I had to enter it into the aortic section. I was able to enter the valve model and size, but nothing for the aortic device because there wasn't one. Implant 1 was left as missing, but for implant 2, I was able to enter no additional devices. Is this correct?
So, Carol, can I chime in?
Sure.
So, Jody, if this was just an aortic annular enlargement, you're not going to put that as an aortic procedure. So, if you're doing an AVR and an annular enlargement, That's just an AVR and an annular enlargement. You do not open the aortic section for that. It's pretty clearly laid out in the training manual.
Yeah, really important. We provided a lot of updates in the training manual on this. So for this procedure that you're talking about, it's just an annular enlargement in addition to the aortic valve. This is often done with valve placements. When they're seating the valve, they oftentimes have to enlarge the annulus. This is not an additional aorta procedure. You're going to enter the aortic valve and you're going to enter the aortic annular enlargement under the aortic valve section. We have conflicts for QGIP's reporting standpoint. We can only dispute results from a published report. Will we get emailed when the report is? Yep, we will let you know when we have more of a timeline, and that will be before the report is out, so you have an idea of when those reports are coming. 7451 data specs denoted the format is multi-select, but the DCF does not include language. Select all that apply. So for that field, we're just going to select one, Carmen, and I think Paul had answered you on that on a separate email. Next question, would you need to offer counseling if they are former smoker? So I believe that this, the way the NQF measure is written, what was the number?
It's sequence 7016 and it's 2597.
So they have to have a positive screening. So whatever screening tool you're using, that's what you would determine if they need to receive counseling or not. Okay, so when do you code NA for this question? That's good. That's in the training manual as well. So if the patient is medically, mentally, or emotionally inappropriate for referral, then you would select not applicable. Next question, what is considered appropriate counseling for substance abuse? So this is this again, it goes back to what your hospital system has designated as the appropriate counseling. STS is not going to determine what, I think this is the CMS, the NQF measure. We're not going to determine what appropriate counseling is. I would refer to this measure and then what your site has in place for counseling. If they're negative for all three, why wouldn't the counseling not be applicable? Because if they are negative, no counseling is needed. So again, this is the two-part question. You're going to answer yes if the patient is negative for all three and does not require counseling. So the question, let me clarify, because I think I can understand why there's confusion on this when the patient's not screening positive. The question is, was this measure met? And the measure is, did the patient receive counseling when appropriate? You can answer yes to this measure if no counseling was required because that patient is still being treated appropriately. So you can answer yes for patients who screen negative for all three and did not receive counseling because their treatment for that, for their screening is appropriate. Is that helpful, Melinda?
Yeah, and I think, again, just the concept that this is two-part. The first part is, did you screen the patient? Okay, so there has to be the screening, and then there has to be the counseling if needed. So if you screened them, you did part one, and they're all negative, they don't need counseling, you could say, yes, you met this measure. And then for the NA, these are people who emotionally, physically, or for whatever reason, you can't do any of this to them. In my mind. So I think that's probably a clearer way that's how I'm doing it in my mind. Does that make sense, Carol, to you?
Yeah, that makes sense to me too. I agree with that. Donna, there's a question here if you wanted to speak more on the CMS bundle payment. If you're able to, I'm going to go down to the next question. When attempting a large file, less than 50 megabytes, uploading got stuck, spent hours with tech support, finally had to set me up under a new username. Okay. It sounds like tech support helped you. I'm not sure what the issue was, Anita, Melanie, or Joe, if you wanted to speak on that. But it sounds like they had some issue with your account and they were able to help you through it.
And this is Donna. Sorry, it was hard to unmute.
Sorry.
The bundled payment program is something that's through CMS at the hospital level and covers all sorts of different procedures, ortho, gynae, I don't even know what all, but it's elective. So your hospital may or may not participate in that, but they're just adding cardiac surgery to the bundled payment options. So this is one of the measures that's required for that system.
Thank you.
And Carol, it's Melanie. I just wanted to, in regards to the statement that Anita had put in. So Anita, I believe if you got stuck at the loading icon, if that animation was still going, we are looking into that. It seems to pop up, not for all users, where when uploading the file for some reason does get into a hung state, but we need to be able to get it out of that state. But so we're looking at making sure that if there are future uploads that get into that stuck state, that the system will recognize that and time out after a certain period. So that's what it sounds like happened, and then they switched you over to another user, but we are looking into that. So it is not just this scenario of where we just give you another username. We are looking at the root cause and looking at a permanent solution. So thanks for sharing that, but I did actually get information from the support team regarding that, so I am following up with our development team.
Wonderful, thank you, Melanie.
Mm-hmm.
Next question, why does the 4.2 cabbage worksheet have all the why doesn't the 4.2 cabbage worksheet have all the distal locations like what's on the 2.9? So on version 4.2, we don't have
We don't have the breakdown. We don't have like OM1s, OM2s, OM3s. They don't have.
No, we're collecting branches. So we have left coronary, the LAD system, the diagonal, the RI, the CIRC, obtuse, RCA, PDA. These are not broken down into proximal, mid, distal, OM12, CIRC 1-2. So the worksheet matches what's on the data collection form. And this is the data collection form, and then here's the worksheet. What is the specific fixed date for STS 3186? It has been about a month.
And this is Melanie, and the date for that release is August the 1st.
Great, thank you. For substance use measure, how is brief counseling defined? It's defined according to the CMS definition, and I would refer back to the link that's in the training manual that goes to the NQF site to review that definition. And it has to be a systematic tool that's used at your hospital along with counseling that fits that measure definition. IQVIA issue, is it possible in the future to identify issues as global, meaning it is an issue that all participants should anticipate, isolated, meaning that the issue is isolated to one or a few participants? Thank you.
Hi, it's Melanie. Yes, we will try to just at least identify those so that everyone is aware if it's impacting all versus maybe just isolated to certain sites. So we can provide that.
Great, thank you. Next questions. If the patient takes hydromorphone every day for medical reasons, pain management. Now I'm going to assume, Mary, that this is a prescription medication. Should we code illicit drug use within 1 year? So no, that does not meet the definition for illicit drug use. And then how do we code substance use screening and counseling? So this is a prescribed pain medication, and the answer to both of those, it does not meet the definition for illicit drug use, nor does it meet the definition for the substance use screening to code that as one of the yeses within that. Next question. Can you please outline the type of errors, critical and other types of errors?
Yes, I can definitely do that. And I also want to point you to a resource that's on the STS website that is related to the uploader. It does have those definitions in that guide. So I also just wanted to point there, if you were to navigate to the STS National Database site, there is a database transitions page, and there is an uploader user guide or user reference guide that also has this information. For critical errors are identified as items that are usually being sent that are not expected per the data spec. So for example, if there is a set range for a field, let's just say that it's 0 to 100, but a value of 300 is being sent for that value, the system will generate a critical error and will not allow the record to be saved to the database. So usually you will see those types of related errors if it's something that is basically going against the defined data spec. Another type of level of validation is a error. And with an error, you will, that's next, just in regards to levels of severity, that would be next in line of what you would pay attention to and validate. And so within the errors, you could see if there is a mismatch in what is being entered, for example, where your the answer is maybe stated as a yes, but in actuality, there is a conflict and should have been answered possibly as a no. So that usually will be a level higher in severity. And then warnings are usually going to provide informational related information. It is not going to, for error and warning, it does not prevent the record from saving to the actual database. It will allow the records to come in. So I just wanted to also point that out. But with warnings, you will see there is a level of being able to just notify you if there is maybe a potential mismatch, and allowing you to go in and just review the information. Again, doesn't prevent you from getting the data into the actual database. But for more information, I know that we do have a section in that guide that has a breakdown of the different levels of errors and warnings and criticals. So if you want further information, you can also take a look at that user guide.
Thank you, Melanie. That was very helpful. Will there be a report giving a quick look at total procedures? And I'm not sure if she means, I think that was your critical summary report, or no, the one report that's coming in August, where it shows the PROC ID. But I'm not sure also if this can be used, could be accomplished with the harvest summary report.
Total number of procedures. I don't think it gives you by procedure. The only other thing I can think of is if you were to use the dashboard, you do have procedure filtering available, and you are able to see the total number of cases by procedure using the dashboard. But I know that we have had enhancement requests to give a summary level for procedures for by surgeon. So we don't have those specifically in at the moment. But if it's something that you can use the dashboard to be able to review those total number of cases by procedure, that would be able to, I believe, give you what you need.
Great, thank you. Next question, Leanne, I'm gonna need you on this one if you don't mind. If you could please type in the email address for Dia to reach out to Jane for the direct data entry and to get more information on that. The question is there any update on direct data entry into IQVIA, upcoming webinars on this topic? So we did have a webinar for folks that were interested in direct data entry. That was advertised on the webinars back in June, and we had that, I believe it was the end of the month, prior to go live with direct data entry on July 1st. if you missed that webinar, or this is now a time where this might be a better opportunity for you to get more information on direct data entry, please email Jane at stsdb@sts.org and she'll provide you with that information. Next question, when the Harvest One report becomes available, will there be a call to go over it? Oh yes, definitely. We're going to do lots of education on the report and how to, it's actually going to be the Harvest One dashboard, the benchmark dashboard. It will be a new dashboard that's available in your reporting function, and we'll go over that in detail with IQVIA. There'll also be a session on using it at the site level at AQO, I believe. We're trying to do that as well. So yes, we'll have lots of training on the Harvest One dashboard. We could really use a list of the mismatches in the files. For instance, reason for urgent surgery is AMI, but previous MI is marked no. Is that already showing up?
I believe that should be already showing up on the data quality report if that is being sent at the time of submission.
I believe so. I believe that is on there. So, but if you have an instance where you're not seeing that on the data summary report, maybe you could send in a ticket to the IQVIA help desk and they can look into that for you.
Yes, definitely. We would want to take a look at that.
Yeah. Once those items are fixed, how do we know so we can resend the files? How are people keeping themselves organized? Do they resend a month at a time? And at any time they update anything, resend then the month again? And Melanie, I'm not sure.
No, there's no need to resend. Yeah, we'll just stop right there. There's no, for the fixes for the items that were reported earlier, there is no request for users to resend or re-upload their files. These updates are being done within the reports and it will generate off of the data that you've already submitted.
Right, thank you very much for clarifying that.
Yes, thank you for bringing that up.
Yeah, no problem. I didn't want to go further because that can get really confusing. So just to restate what Melanie said, once the updates are done, you do not need to resend the files in. Those updates are applied to the data that's in the warehouse already. Now, the next part of the question, I also want to clarify the next part of this question. It says, how do you know for sure that once close time, everything is clean? So that's what the Harvest Summary Report is for. When you go into the Harvest Summary Report, you can select a whole year's worth of time or whatever time frame you want to look at. You can select that time frame in the Harvest Summary Report to see what data is in there that's going to be submitted to analysis, and then identify any other data that you may need to clean up within that time frame you selected. What would we do if the risk values don't match? So some sites, they really should match because the risk models at IQVIA are the same risk models that DCRI is using, and it's the same models. For 4.20, they should definitely match. It's the same models all around. The vendors will be using the same as IQVIA and DCRI. There are some issues. You can reach out to your vendor if you're seeing values that don't match. There may be an issue with mitral cases from version 2.9 that when the models first came out and version 2.9 first went live, there was an issue with mitral cases and concomitant tricuspid cases that may have thrown off a risk score, but this was a known issue. So you can reach out if you're finding something, but hopefully they all match. And some sites don't pay attention to that. Other sites are very aware of their risk scores and making sure that they match. So if you have a question, reach out and we can look into it further. Anything to add to that, Melanie?
Nope, you covered it.
Will there be a report for physician mismatch?
Report for physician mismatch. I guess I need more context. What does that mismatch on what?
I think, this is Donna, I think they're asking if the physician MPI isn't on the list on the Schedule A, and I believe the answer is that's not in place just yet, but will be.
Correct. If that's what that request is, yes, that's not in place at the moment.
Okay, great. I think we're at time. We're going to answer, I guess, let me see if there's one more question. I can take this one about the risk this is not the risk calculator for 4.2. We released the risk algorithm and the covariate coefficient charts. The statistician at DCRI are reviewing the algorithms one more time to make sure that everything has been mapped properly from 2.9 to 4.2. Once we have that from them, hopefully, we are supposed to have it on Friday. They want it to take a little bit extra time at the beginning of this week to review it, and I expect to have that back hopefully within the next couple of days. We're really close, and then once we have that, we do have a call set up with the vendors, and we'll be sending the risk model information along with hopefully test files to them prior to that call. So I think we're done. Thank you very much. We went over a few minutes, so thanks for spending extra time. Thank you, Melanie, Joe, and Donna, and Melinda for your help. And Leanne. Again, the Harvest One reports will be coming out. We don't have a timeline on those yet, but as soon as we do, we will communicate that out. This will be the only time where the Harvest report takes this long, as we're working out all of the kinks and making sure that the data is ingested correctly back into IQVIA and displayed properly on the new dashboard. So once we get through this, it will be a much better process for the upcoming report. So thank you for being patient with us on that. And as soon as we can, we will get you as soon as we're able, we will get you information out on that. So thanks again, everybody, and I hope you have a great day and stay healthy. Thank you.
Thanks, Carol.
Thanks.
Thank you.
Thanks, everybody.